Hi, welcome to another edition of the LIS Connection from Orchard Software. In today's episode, we are going to discuss an increasing trend in what is digital pathology. It has finally arrived. Digital pathology has arrived. And I've got two guests with us today to have a discussion about what that means for the pathology world and the laboratories that work in them. First, we are excited to have Bob McGonnagle, the publisher of CAP Today, joining us to offer some of his thoughts and opinions. Bob, welcome.
Thank you very much.
Maybe give us a little bit of background. I know that you've been the publisher of CAP Today for quite some time.
Yes, I've been the publisher of CAP Today since 1987, which is a fair track record of history, I guess. We've been involved with digital pathology from the very start, from the earliest startup companies, and there's several that were important. And I also am the publisher of the college's peer-reviewed journal, the Archives of Pathology and Lab Medicine. And we've been publishing articles in digital pathology and AI, of course, which is coming on as well, for many, many years. So when we say that digital pathology has arrived, I believe it certainly has. And the next few years are going to be of the greatest interest so far.
Well, we're really excited to have you and to get your insight. Also with us today on the LIS Connection, I'm excited. I've recently made a new friend in the digital pathology space, and that is Dr. Alexandra Zuraw. She is a practicing veterinary pathologist and also the publisher of Digital Pathology Place. Hi, Alexandra. How's it going today?
Great. Thank you so much, Stephen, for inviting me. And so good to join Bob. I'm compared to your being publisher since 87. My publication only started in 2021. So I'm a baby publisher, baby online publisher, but heavily drawing on different CAP publications. So thanks so much for your amazing work.
Thank you.
Great. So Alex, I was
on me.
Yeah, I was on your site recently on the Digital Pathology Place, and I noticed that you have a new book.
Yes. So actually new is a little bit, well, I have to make it newer, but I do have a book, Digital Pathology One-on-One, for those who are starting their digital pathology journey. And we're going to be working on the next edition. That's my first edition. But if you go to the website, and if it's okay, we're going to link to the link in the show notes. It's digitalpathologyplace.com. Whoever is starting a digital pathology journey and is a little bit confused what this is, which we're going to be talking about in this podcast, can also get the free PDF copy of that book on my website to basically kickstart their journey. So a quick intro to my digital pathology journey. So I'm a practicing veterinary pathologist working mostly in the drug development space, where most of the veterinary pathologists work. But my journey started with image analysis in an image analysis company. And then after I left that company, I thought, hey, there is a little bit of digital pathology expertise lacking in the industry. And I started a blog and a podcast, and then it grew into an online publication, what is now Digital Pathology Place.
Mm-hmm.
Yeah, interesting. I've enjoyed some of your podcasts that you have on your own podcast channel and learned quite a bit. So I thought maybe today we would start, Alec, with you and see if we could describe for those that are maybe entering digital pathology for the first time, what digital pathology is and how it is really transforming the traditional glass slide microscope workflow.
Mm-hmm. So I'm going to give my personal perspective of a pathologist who's been working on digital slides for the last, 5 years. So like the very, very high level explanation is basically doing the pathological evaluation on a computer screen instead on a glass slide. The underlying technology is the same. So there is often this question, do we have to train differently to be able to do digital pathology? And the general answer is no, because the underlying technology is light microscopy. The only difference is that you look at the images as a pathologist to do your diagnosis on a computer screen. And there is obviously a learning curve, how to use different softwares for that. But in terms of how it transforms the way pathologists work, and I'm going to go backwards from the end user, from the pathologist. It gives, my belief is that digital pathology basically provides faster diagnosis, because you have, through this digitization of those analog glass slides, you can have access to more pathologists. You can consult. Basically, you can benefit from everything that can be now done digitally and cut the time necessary to give the patients the diagnosis. And that's how it not only transforms pathologist workflow, but also transforms care. Basically, improves speed and access to care. And there is a lot more to that, because looking at this slide, it's just the end of the process. So there's a lot of workflow architecture involved into designing it and changing how labs work. But basically, from the pathologist and patient perspective, faster diagnosis with higher confidence, because you can access different experts faster and have a consensus diagnosis on a digital slides in minutes instead of shipping these things around.
Right. And I know, digital pathology started maybe 2 decades ago. And it's been really a long journey to get to where we are today, where it is now basically gone mainstream. But what were some of the things as a practicing pathologist that really kind of stood in the way? What were the hurdles, from work that I've done in the past? A lot of the classic pathologists really were skeptical if the technology would get to the point where they would trust the image on the screen, so to speak, and that, all of their training, pathology and reading slides is like an art. And they just didn't really buy into, for a very long time, that technology could get to the point where they could trust the image versus what they see through the microscope. And so what do you think was the tipping point that really led to us getting to the point where now primary read diagnosis is FDA approved and on many applications and many technologies? But what was the tipping point? What really drove the ability to get to where we are now?
So there's, so what you're describing, I hear it over and over again, and said by people who are just entering the space. So this fear and the main hurdle is always change management in terms of this technology. And this digital slide that we're mentioning is the point of where a lot of different things can happen. So one of the things is reading it. Okay, are we confident that it's as good as under the microscope? Then we're going to be talking probably about AI, because there's no digital pathology podcast episode without AI. But now we have this digital material, digital diagnostic material. We can do AI on it. Is this AI good enough? So basically the same type of kind of fear. Is this good enough to provide a diagnosis? But there is an industry tipping point for me that is being strengthened with every additional scanner clearance. So to me, the first, as a veterinary pathologist, actually, that was already before the Philips clearance in 2017. That was the first cleared scanner or digital pathology system, not just scanner. But the scanner, the same system system was actually deployed in veterinary pathology at scale 2 years before. And then the FDA gave a green light for digital pathology to be used for primary diagnosis. So this was like the first big domino that where a very world-renowned regulatory agency required stringent studies basically to address the concern of pathologists and clinicians. Is this good enough? Is it gonna be? Will it provide the same quality of diagnosis? And the answer was yes, it is non-inferior, and every next scanner, and I think, how many do we have? 5? I don't know. But we have at least 5. We have, and at least 5 companies that have that, and several companies have multiple scanners, and every single scanner is showing that, yes, it is non-inferior. Regardless of that, every time I hear new people coming into the digital pathology discussion, there's always this fear, hey, is it going to be good enough? Yeah. So these two things, change management, and the tipping point was the clearance.
Right. Yes. And I have to believe that there was an aspect of COVID where, it helped really push based on need, based on just true availability of trying to get those diagnoses done in a time where shipping slides around or being there in person was much more difficult. And I think digital pathology really stepped up and forced a real look at it, and then proved that it really did help and speed up. And then coming out of the COVID years later, I don't think we've seen many mistakes that were made or flaws or things that happened during that as well. So Bob, I'm going to go to you, who, obviously with your long experience with CAP today in the pathology space, curious to see what you've seen over the past 2 decades and how digital pathology is transforming traditional pathology workflow in your world.
Well, thank you. It's important to stress, I think, that there were legitimate technology hurdles that had to be overcome in order to validate digital pathology for whatever application. And that's why in drug research and drug development, we had so many veterinary pathologists who stepped up to the plate. They did not have an FDA hovering behind them, and they were a lot of the pioneers in this area. As we began to approach the FDA had plenty of questions, not the least of which there was no predicate device, because the light microscope was not subject to the 1987 statutes under the FDA. It was grandfathered in as a device. So there was no predicate, so to speak, for digital pathology. That being said, I think the key thing that has helped in the last 5 to 6 years or 5 to 8 years, the pathologist shortage that was so pronounced in Western Europe, almost everywhere, began to come home to clinical pathology in its practice in the United States and North America. And nothing has done more to help accelerate digital pathology other than technological development than the shortage. And all of a sudden, it's become the question of we simply cannot do our work without it. And as you say, once we get in COVID, pathologists could sign out from home. That was a very big boon. Systems didn't particularly want practitioners in this physical space when there was an epidemic underway, and there was still work that needed to be done. So this has been absolutely critical to getting us to where we are today.
Yeah, and that's a great lead into my next question, which, Bob, we'll start with you, and that is, how are labs using digital pathology to address staffing shortages and improve efficiency? Because not only did we have the shortage you mentioned with pathologists in Europe, but in this country, we've seen sort of a turning of the guard, where a lot of the veteran laboratory technicians are retiring, and we don't seem to have enough of the new and up and coming laboratory technicians, which has led to a shortage, a very real shortage. And wonder if you could comment on that.
Well, there is. And of course, digital pathology, like any other kind of technological advancement or help, has helped to bridge that shortage. A very good example of that is in the frozen section. In many cases, the frozen section traditionally needed a pathologist to be at the site of the operation. But now with digital pathology, you can have assistants who cut the frozen section and then digitize that and send it back, so to speak, to the mothership, where there are pathologists on site who can evaluate that frozen section and communicate to surgeons. And that's proved to be an enormous boon in the shortage situation that we've seen. We've written on that many, many times now in the last 4 or 5 years. So that in itself alone has been one of the real proof cases. How labs generally are implementing digital pathology, to some degree, it's a sliding scale. On the one hand, we have institutions, most famously Ohio State, Memorial Sloan Kettering, now the University of Pittsburgh and IU, where the workload is increasingly digitized, sometimes 100% digitized, but then not perhaps net read in a 100% digitized way. Some faculty may have a handful of pathologists who read out the digital. Others have more than 80% of the faculty reading out the digital. So there you really do have a distribution, but it's all tending in one way, which is to have a total digital readout.
Yeah, not to mention a lot of the doctors in training and the med students and the residents are being trained. In fact, I've talked this on digital pathology, and I've talked to some who said they never saw a glass slide in medical school, and everything was done digitally and in images. And so Alec, in your lab, and in your practice and in others that you visited, have you seen the improved efficiencies?
I have seen, so the main advantage I see is kind of parallel to what Bob was saying. The option to have remote sign out and to be attractive as an employer to the new generation of pathologists. So in that term, efficiency and scale of providing care. And like you mentioned, some pathologists, the new pathologists that are now coming out of residencies, they're digital native digital pathology. This is what they trained on. They probably saw glass slides, but me already, I was learning from my board certification, and that was 2016-17, entirely on digital slides. So there's no gap, and also there's the expectation from them that this is going to be provided by the employer. So if you want to be competitive as an employer, this is what you need to provide to attract talent, to attract doctors who will be providing the diagnosis for your patients. Efficiencies, I see them. So the efficiencies, there's also a little bit triggering thing for the pathologist, because whenever we talk about efficiency, it's like, oh, work faster, read more cases. And the emotions that are being caused by this efficiency promotion in pathologists are like, hey, don't push this on me, because I need to have enough time to provide a confident diagnosis. It doesn't matter if I'm using a microscope or a digital display. I want to be confident in my diagnosis, and I don't want to need to do it faster. But by the means of digital equipment that is high quality, good quality display, you have all the information from different system in one place, you will be more efficient in your work. And I don't want to advertise being more efficient in reading a particular slide, but definitely more efficient than like pulling stuff from different places, shuffling paper, shuffling slides. So in that term, yes, I see the efficiency, and I see this as being something that is very attractive for new talent, and also a motivation for people to go into pathology, because now it's cool. You can do AI, you can, work remotely, and all these advantages that this specialty didn't have before.
That's interesting. Yeah, I bet. Being on the cutting edge, right? And so with all that, there are obviously barriers, right? Barriers to adoption. So I wonder if maybe we'll start with you, Alex, on what you've seen in terms of what are the biggest barriers to adoption, and how are organizations overcoming those?
Mm-hmm. Also twofold, and one thing we already mentioned, the resistance to change for people who are new to the technology. But that aside, deploying this type of new technology that affects different steps of your workflow in an institution is a major undertaking. And we kind of started talking about that in some institutions, even very famous for going digital, it's still gradual, right? It's not like we throw away all the analog and we put in digital. And it is multifaceted, right? It's obviously investment in equipment, investment in software, investment in training, and investment of time into this transition of pathologists from being actually comfortable with the digital, and specifically those who are not digitally native. So because it's very multidisciplinary and has multiple steps, deploying something like that in an already functioning large organization is a major challenge. So there's going to be all kinds of questions like, okay, what's the return on investment? How long is it going to take? Like, what will we get out of this if what we're doing still is okay, right? We're providing care. We're still doing our job. But then looking at it from a little bit of a different angle, okay, now we have this digitized diagnostic material. This is data. There can be digital tests done on it. There can, including AI, different types of image analysis. You can leverage the consultation capabilities, both in terms of improving the quality of your diagnosis and revenue for an organization. So challenging, because changing something in a big organization is difficult, and change management of the users, but definitely worth it when we look at the big picture and where healthcare is going in general.
Right. Wow.
Let me just add a couple things. 20 years ago, you used to hear, well, look, surgical pathology is actually a pretty inexpensive thing. We process tissue, we stain it, we cut it and put it on a slide and read it. And what's the big deal? And we have FedEx, and we can send a glass slide around pretty cheaply. That was considered for a long time, to be a pretty definitive answer to those who were pushing for digital pathology. So what has changed? Well, for one thing, the world of surgical pathology and clinical medicine is really getting to be much more like what Alex has experienced in the drug development laboratories where so many pathologists work. And what do I mean by that? There's an importance that there be a homogeneity of diagnosis in cases. It's if the Pfizer pathologists are all disagreeing amongst each other, that doesn't help Pfizer get applications to FDA any quicker. In fact, it slows it down. And so you see now in clinical medicine, there's ever greater emphasis on consensus and coherent diagnoses across the board. in subspecialty areas, particularly, remember, if there's a shortage and somebody doesn't come in that day and someone's pinch hitting for them, it can't be a completely different approach to the pathology report, or the poor surgeon wouldn't really understand perhaps what's going on. The other thing there that naturally comes along is pathology is becoming very, very subspecialized. So the subspecialty pathologists need to have a consensus around their product. And then increasingly in clinical medicine, there's a lot of second opinions and consultations that go on. So there needs to be a kind of a range of consensus that is tighter than it ever was before, even in the reporting, even in the way the terminology that's used. And I think that's all helped to drive digital pathology adoption.
Interesting. Yeah, that you brought up the consultation, right? Because like everything digital, it opens up the world, right?
Right.
And now all of a sudden you have access to not just the experts in your state, for example,
Of course,
or in your country, but experts around the world and all these different subspecialties that you can ship an image over to and have a quick discussion, which leads to overall better diagnosis, right? I'm curious, Bob, if you have in some of your travels and I know Cap today does a lot of panels and things of that nature. If there's a story or an example where that you recall where digital pathology really made a measurable impact.
well, I think it's digital pathology right now has been the great enabler of the very large systems that we see and the consolidation of laboratories that we see. I always point out the biggest non-governmental employer in the state of New York is Northwell Health. The same is true in UAB. UAB Healthcare is the biggest non-governmental employer in Alabama. IU is the biggest employer, IU Health, in the state of Indiana, as you know, where you live.
I know it well. I know.
So the point here is if we're going to have these large networks covering these large geographies, we have to have the portability of pathology images. There's no way a system that has 20 clinics and 8 hospitals plus 2 flagship hospitals and a children's hospital and then a cancer hospital can staff that many pathologists to do all the pathology work. They have to be able to have it in one central location. That's been an enormous difference and an enormous change. And that probably is not going to go away anytime soon.
Right. Alex, was there you said, I think you mentioned 5 years ago is really when you dove into it. Maybe talk about the reason why.
Mhm. So I was fortunate that I was involved in the digital pathology initiatives in my organization, and like we already mentioned, COVID very much helped. So there was one instance where that was pretty relevant to the drug development process. There is a process called peer review, and when a study for evaluation is outsourced from a pharma company to a contract research organization. And there's a pathologist at the CRO evaluating slides, histopathology slides associated with compound toxicity. And there's the pharma pathologist peer reviewing this, basically double checking the work. And the normal process before COVID, before digital, was the pharma pathologist would travel to the CRO and the 2 pathologists would sit together and look at slides with a multi-headed microscope, right? Obviously, the moment COVID hits, this is not an option anymore, but like you have to keep doing it. So you can ship the slides, which takes time, and then borders were overburdened with other stuff, and another aspect that gets into it, that different tissues from different species are like it's biological material. Shipping this is always difficult. So my organization, Charles River Laboratories, together with some partners, implemented the digital peer review. And that was something that basically unblocked this bottleneck in this very moment, so that they were able to do it very fast, validate this. So the pharma and drug development operates under a GLP regulatory framework, good laboratory practices. So there's also validation requirements for that. But that was like a milestone that happened during COVID that made digital pathology for the drug development space no more nice to have thing, but something that was necessary at that moment.
Yeah,
And
a need to have.
yes, a must basically to keep working on the drug pipelines. So that was something that was game changing in my career. Yeah.
Yeah.
And also one little example that kind of is parallel to what Bob said. I hear different stories from different digital pathology trailblazers on my podcast, and there was one podcast in particular where a pathologist who had an independent practice, she was supposed to service, instead of one hospital, she got another one where she was supposed to be the pathologist, but because of the distance, she was not able to do it non-digitally. So basically, digital pathology enabled her to diagnose for the patients in the other hospital. Otherwise, she would have had to refuse.
Yeah. Well, that brings up my next question, which is integrating into other lab systems like LIS, and we already mentioned AI tools. Obviously, Orchard Software, we're in the world of LIS and connecting laboratories to their equipment and to their reporting and so forth. And so we've been working with a lot of labs over the past couple of years in the pathology space, integrating to digital pathology and other systems as well. I think what I want to say about that is that, as you mentioned, change is not only hard, but also takes quite a bit of time, and oftentimes in the laboratory space, not fully understood what it takes to implement something like digital pathology, where you're bringing in scanners and you're having new software, and it's having to connect to everything, and then new workflows, and that's all before we get to the pathologists and they actually use it, right?
Right.
And so curious about that. And then also, I think AI is another over the past less than 2 years, right? I mean, AI has been, it's gone mainstream and gone public in the last 2 years, but it's been used widely for a while, especially with a lot of the digital algorithms that are integrated into pathology software to aid in diagnosis, breast cancer algorithms and lung cancer algorithms and the algorithms that are associated with pharmaceuticals that are necessary for a personalized medicine approach and to get FDA approval and things like that. So I wonder if we could touch base on that. We'll start, Bob, with you on what you've seen as far as AI tools and connecting and integrating with the lab for digital pathology.
Well, I mean, AI has excited everyone around the world. It certainly excited our stock market, as you all know,
right?
As we all know. And it's excited people in clinical medicine just as well, because any benefit that can be conceived for patients that AI might offer is going to be eagerly explored, particularly in an environment where there are shortages across the board in all of healthcare. I mean, we're not just talking about a shortage of pathologists. We're talking about a shortage of essentially everyone. So AI looks like it can fill a gap. In truth, laboratories have been using something very close to AI. If you think about the PAP test algorithms, where the machines they weren't giving you the definitive diagnosis, but they were saying of these 25 tests that have come into the lab today, here are the 25 most suspicious that need review. That was really a wonderful application of AI for this automated screening. And automated screening is what we depend on everywhere in the lab. So this is pretty natural. And then we have FDA approvals of some very exotic AI implementations by commercial entities, approvals in important organ systems, prostate, breast, others. There's many up at FDA. So there's no question that AI has fueled a lot of the interest here. And there's a kind of a fear of missing out. If I'm not prepared to meet the AI applications in pathology head on and incorporate those in a timely way, I may be just left by the wayside.
And that's an interesting point. I was gonna ask Alex to comment on, and that is, we mentioned digital pathology has arrived in the mainstream, and it used to be not too long ago, in my opinion, that if you were doing digital pathology and you had scanners and you were using algorithms and things of that nature, you were pretty much ahead of the curve as far as most of pathology. I would maybe argue today that if you're not on digital pathology, that relatively soon you're going to be behind the curve.
Yes, so now that the tables have turned a little bit, because and especially in the younger generation of pathologists, this is the expectation, this is the norm. But what I'm seeing at the conferences, and we're going to get back to the integrations with software, which is crucial here as well. But what I'm seeing at the conferences, at the Digital Pathology conferences, not only at pathology conference. Actually, I did this exercise at the non-specifically digital pathology conference. I went through the exhibit hall and wanted to interview every single digital pathology company, and I didn't manage because it was every other booth, or even at least 50% had some aspect of digital pathology. So when you look at the conferences, this is the mainstream. Doesn't mean that the adoption is mainstream as well. And what I see in terms of people attending the conferences are the people who are from places where this is both the people who are interested, looking for new solutions for the lab, but also a lot of people who want to learn more and see, okay, are there options to have an additional way of practicing digitally, even if my primary way of practicing is not digital? They literally look for these opportunities, and also to learn about things. And going back to the integrations, for those who are practicing this, like we mentioned in Ohio State, they refer to their problems as first digital pathology world problems, where they don't want to click between different windows to open a case. Where you are just starting is how spoiled are you? But then, on the other hand, when you think differently about how much more efficient you could get if the interoperability was the default, right? Because then, okay, you've already overcome so many hurdles, and now you have this annoying thing that makes you slower. Why do you need that? You don't need that. You can overcome that with the proper integration. I'm kind of want to direct this question back to you, Stephen. How do you guys integrate? Have you had experience with integration with digital pathology systems? Because LIS is going to be the hub where everything else is going to go out of an LIS in the lab. So, and also a question to you, how would you guide people? Because in the digital pathology space, a lot of this is being expected from vendors, the guidance, how to integrate the different partnerships. Every lab has different components, right? You're not going to throw away the components and start from scratch with everything that's compatible. Rather, it's expected, hey, help us make it work all together.
Right. So we're doing a lot of work right now with pathology labs, looking to not only get into the cloud. So we've spent the last couple of years bringing everybody into the cloud. And now with the advent of AI and so forth, wanting to bring on digital pathology and looking to us to integrate it for them or to help them with that. And so we recently just completed an update to our or what we call OEP, our Orchard Enterprise Pathology, where we have digital pathology integrated into it. So for those that already have Orchard Enterprise Pathology, we can come in and put in the necessary applications to then connect them to digital pathology, depending on which service providers of digital pathology they want to use. I mean, we're working with companies like Proscia and Gestalt and others to then hook into the scanners and get everything set up for these pathology labs. And it's just getting more and more, we're seeing more and more interest as the months go by, because it's something that I think the realization is they cannot do without at the level of growth, especially at the enterprise level, the level of growth and how fast everything is moving, especially in the AI front, that, this isn't something that gets done quickly. Like this is, you need to plan it out. You can't really shut down the laboratory for a month and put it in, right? You've got to time it out. We got to train, we got to test it, and so, it takes quite a bit of work, and Orchard has that acumen and capability. And so we go in, set everything up, train, test, and make sure everything's working, so that digital pathology can do what it's supposed to do, which is to increase productivity, increase efficiency, and increase the quality of diagnosis, right? It's not going to replace, that's the other thing we hear about too, is, well, are we going to replace pathologists? No, I don't think so. I think what it does is, along with AI and algorithms, it's allowing the pathologist to not only come to the diagnosis more quickly, but to have more information readily available to them to do it, and to get it right as quickly as possible.
Sure. Steve, I have a question also for you.
Yeah.
I mean, I know that the cloud is a very important part of your strategy at Orchard, and you've spent a lot of time and been very successful moving many, if not most customers now to the cloud.
That's right.
But also along with that, I talk a little bit about your use of APIs as a much better way of interfacing to different applications, because the interface, as veterans like you and I know, used to be one of the biggest stumbling blocks in any kind of computing that went on in the lab. But the API, I think, has made it a lot easier to bring all these things together for customers.
Yeah. One of the things that Orchard does really well is API integration. Our solutions come with an external API, and we make it easy for the vendors to plug in. If someone wants to integrate with a third-party system instead, we've got a process for that too. They just send over the tech specs, and our product and dev teams will take a look and see what's possible. It's really all about flexibility and making sure the integration works smoothly for everyone involved. So with that, I think one final question for the both of you is, what trends and innovations should labs be watching out for in the next 2 to 3 years? And I don't know if you've got a crystal ball or not. The way things have moved so quickly, I think it would be hard to really figure out what's going to happen in the next 2 to 3 years, but I'm sure you have some ideas.
Mm-hmm. Definitely. So one thing that I see is the next, and It all depends on implementation because the technology is already there. One thing that I see labs leveraging is something called agentic AI, and this word agentic comes from the word agent, where you have like an AI agent that coordinates other AIs, right? So let's say we would have an AI that coordinates taking slides from the scanner to the image analysis software to analysis to whatever, right? So that you don't have to do it manually. Currently, a lot of this stuff is still being done manually or with more limited automations. I think agentic AI is going to be something that's going to improve the efficiency, like next level efficiency, because you basically can scale the mundane, and integration and interoperability is going to be crucial here as well, with all the programs, all the software and hardware components in the lab. But my guess for the next like 2-3 years, agentic AI is going to be the thing that's going to take the efficiencies provided by digital pathology to the next level.
I think I would place that bet with you. In fact, I think it's going to the agentic AIs is going to really help the laboratory technicians with the shortage that they're seeing, the ability to get some of those repetitive tasks done automatically with confidence.
And the difference of this agentic AI is that it causes, once you understand what that is, it's a lot less, people are a lot less fearful because they're a lot less afraid of, okay, an AI putting something from one folder to another than an AI doing image analysis and providing support for diagnosis, right?
Right.
So this is basically like workflow orchestration, getting rid of the mundane, and people are a lot more open to this, and you can a lot easier calculate the return on investment of a solution like that.
Mm-hmm. Yeah, Bob, are there some future articles coming out that we should be looking at?
I'm sure of that. There's no question in my mind the application of AI to workflow. We're seeing it in revenue cycle management in a very major way lately, and otherwise throughout operations. That's going to be a big thing to keep our eyeball on. Also, on the clinical side, we do have some CPT codes finally for digital pathology. Now, you get the code before you get the money. In fact, sometimes it's a long time before you get the money, but at least you have the code. And people who know how the system works are eagerly filling out those codes to try to establish the kind of data that we need as a baseline to begin payment coming through for digital pathology. And I think once that happens, whether it's a tsunami of money or whether it's a trickle of money, the point is there'll be money, and this people will react to this and think we need to jump on that bandwagon as well. So from workflow and whatever kind of revenue begins to open up and flow through, those are two things that I'm really keeping my eye on.
Yeah, those two great points. Really, obviously, laboratory economics. That's also probably on a whole nother episode we could go into, Bob. All right. Well, listen, I really enjoyed speaking to both of you. I want to really thank you for giving your insights into what I think, along with AI, digital pathology has arrived, and I think laboratories. Pathologists obviously know it, but I think laboratories really, and that's who we serve at Orchard Software, want to understand what it means and how it's going to influence the pathology laboratory. And I think you both gave some great perspective, and I really appreciate it. Once again, thank you to Bob McGonnagle, publisher of CAP Today, and Dr. Alexandra Zuraw, who is a practicing veterinarian. If you want to learn more about or keep up to date with digital pathology, Dr. Zuraw has her own website, Digital Pathology Place. She also has a podcast once in a while that you can join. And of course, Digital Pathology 101 book for free. Just go and sign up. And as always, Cap Today is at the cutting edge, and so be on the lookout. I think there's probably some digital pathology articles in the archives that you could probably go and pull up that they've done. Appreciate both of you. It was wonderful to talk to you, and thank you for being on the LIS Connection.
Thank you very much. And thanks to Orchard for the invitation.
Thank you so much. It was an honor to be your guest.
Bye-bye.
Bye.
Bye.